Hey, hey, hey. Happy Friday, everyone. This is Blake Hotchkiss with the Association for Vascular Access. Join with me, Director of Clinical Education, Judy Thompson, and our special
And
guest,
Emma
Emma Kay.
Kay, because Emma Kay wanted to help do the interview with Nadine. Welcome, Nadine.
A frequent guest on Zoom calls. And hey, Nadine. So, welcome. Really, what we're talking about today is Scientific Meeting 2022. So, if you are not registered to come, you are missing out. And that's why we're bringing on our speakers so we can show you just a little bit of a taste about what you're going to see live in person at conference. So, Nadine Nakazawa, thank you for joining us today, this wonderful Friday. And tell us if I've never met Nadine. Now, you and I work closely together on some AVA projects, but if I were to meet Nadine for the first time, tell us a little about your background.
Well, hi, everybody. I've been a member of AVA since it was founded in 1985 under Suzanne Herbst. So my heart and soul belongs to AVA and has over the past 35, 6, 7 years. I don't even know how many. I can't even subtract back to 1985.
But
Um,
Nadine, you're only 40.
what? Is it
But you're
close to?
only 40 years old.
Yeah, bless you, my dear. Thank you, thank you, thank you. Yeah, and yeah, no, 37 years, I think, because my son was born in 1985. That's right. Okay. I have. I was on the board of directors in the 2000. I was president of AVA around 2008, I think. I got the Herbst Award in 2010, which is the Award for Vascular Access Excellence. I've lectured at probably two-thirds of the AVA conferences, and probably 20, 25 years ago, in the early years of our journal, I wrote a quarterly column called Difficult Vascular Access Situations, and I would present one or two interesting clinical scenarios that I encountered. And I got a lot of really positive feedback on that I was sharing difficult clinical scenarios. And I've presented difficult vascular access situations at regional and national conferences. I've spoken on a lot of different topics over the years. Currently, I am on the clinical practice guideline. Do we call it a committee or a task force? Something like that. But it's a very long standing project that's going to take a couple of years. And I'm in charge of one of the sections on insertion. So,
Very
and I'm
fitting. Yeah.
also on the board development commission. I'm chair elect, so I'm in my second year. Um, so I've been involved in AVA for a very long time. For those of you who have never come to the AVA conferences, this is where you come to get uh, energized or re-energized, and to really think and talk and be immersed with everything that is vascular access. It's where you meet people, you meet colleagues for the first time, or you meet friends that you've made over the years. So it's so much fun and very intense and such a positive experience. The topic that I'm going to be presenting is, oh, are you going to ask that as a question? Or what else am I supposed to say? So
That would be the segue too. Well, you talked about difficult vascular access, your background with that, which is so fitting because you're going to be talking about that at conference, right?
yeah. So, what do I do currently? I've been a nurse for 42 years, all at Stanford Healthcare, Stanford Hospital. They call it Stanford Healthcare in Palo Alto, California. I started the PIC program in 1990, so 32 years ago. I was program coordinator for 17 years and chair of the Vascular Access Device Committee for 14 years. So I've done a lot at Stanford. Our team continues to grow and our scope continues to grow. And as I am working with the newer staff who may be experienced vascular access clinicians in community hospitals, scenarios will come up and we'll share what the scenario is, and um, really fill in the gaps for their background, because they've not encountered this level of complexity that we see at Stanford. We see such complex situations. But in the community setting, you might meet patients with these kinds of problems, and you may be the lone clinician, or you may be working with one or two other people, and you have to encounter, assess, and then come up with an answer. So I've taken a number of scenarios that I've encountered and created, I'm going to create, I think, a presentation, and it is, I'm going to share what some of these complex problems are and how I went about problem solving it, but getting a lot of audience participation into how you would approach it as well.
Nadine, you're always so popular at conference, and you're always such a wealth of knowledge. I remember my first AVA conference, I went to listen to you speak, and it's like, oh my gosh, you're such a wealth of knowledge, and it's always fun to have you there. So I think this will be just so valuable for so many people. I'm excited.
Yeah.
Thank you. So for those of you who are like on the fence about attending conference, there will be, I think how it's going to happen is you could listen to the virtual conference, but it's only the general session speakers. So you could, if you're not able to come to the conference because other members of your team are coming, you can do that. But the breakout sessions are not going to be part of that package. So if you want to come to the breakout sessions and you're interested in the topics, you got to come to AVA, the scientific meeting in Minneapolis in September, October. I'm speaking, I think, on the first day in the afternoon. There's lots and lots of really interesting topics in terms of competition. I do hope to have a full room no matter what. But there are lots of great topics throughout the entire conference. So attending conference, you will actually struggle to figure out which one do I want to go to, because sometimes there's 2 or 3 topics all at the same time that you might want to attend. So think about my topic. I'm not going to really say anything much more because I want it to be a surprise when you attend, because that's how I encounter complications. I get an evaluation order with a couple of sentences about what the problem is, or I get a phone call, or someone runs into me in the hallway and says, "We have this issue," and you have to figure out how you're going to approach it and really think about it. There these kinds of scenarios, there aren't guidelines, so you have to think about your clinical background, what you understand about vascular access, what you understand about devices, what you understand about patients and patient scenarios. Every patient is different. Even over time, the same patient, different things could be happening. And so you have to sort of put all those puzzle pieces together to figure out what is causing this particular problem, and then how to go out about assessing it to figure out what the cause is or what the problem is, and then figure out how you're going to solve the problem. And then how do you communicate and share that information with the patient, with the nurses, with the APPs and physicians, so that they understand all of the different components. And then I share these scenarios with my team, because it's really not that they may or may not be able to figure out the problem, but is how do you communicate that? And that's what I want to share with all of you. I'm so excited to be coming back to conference. I haven't been in a couple of years because I've let other staff attend the conference, but I'm going to be there. And I hope if you see me, come up and introduce yourself to me and tell me about yourself. It is so much fun and so energizing. And B2 on September 30th, come to my session.
Awesome. And they say, conference leaves you kind of full of knowledge, full of energy, full of exciting new things. And I will say I've been to every conference since I got into vascular access, even virtual, but the live ones, you leave. So, the feeling cannot be described well with words because it is so true, and descriptions underwhelm the experience of what it actually feels like. So,
And we're fun.
yeah.
It's fun.
Well, with that,
Absolutely.
guys, thank you for tuning in. Thank you, Nadine, for joining us on the Facebook Live event. Judy Thompson, as always, joining us with these events. So thank you for your time. We'll catch you on the next one. Don't forget to like and subscribe. Follow us on social media. We're out there wherever you are. Facebook, Instagram, LinkedIn, and Twitter, and of course, YouTube. So check you guys on the next one.